Motivational interviewing is a wonderful approach to work with clients and patients who are struggling to determine whether or not they want to make changes in their life. The essence of motivational interviewing is exploring with the client what is their life going to be like if they remain the same, and what are the consequences of making changes and what that will require. Let's take a look at the theory of change behind motivational interviewing. Number one, it's important to note that ambivalence is considered normal and part of the human experience. Number two, a collaborative partnership is essential in motivational interviewing to make those skills and techniques effective. Number three, dealing with discord or rolling with resistance is part of the therapeutic process and to be expected. Number four, evoking intrinsic motivation lies at the heart of motivational interviewing. It's important that clients come to their own determination as to their motivators for change. Number five, developing discrepancy. Clients can gain insight as they begin to process the difference between staying the same and making changes. Number six, ultimately, motivational interviewing is about exploring and hopefully coming to a resolution of that ambivalence. Number seven, motivational interviewing is to help support the client's autonomy and self-efficacy, ultimately, that they are the ones to make the decision. In motivational interviewing, ambivalence is a normal part of life and a natural part of the change process. Deciding whether to stay on the same path that one has been on for a while or take a different path can be difficult and uncomfortable. Clinicians using motivational interviewing with clients should make them aware that getting to a decision will feel more like a journey or exploration than it will a sprint or a race to the finish line. Some clients naturally come into counseling wanting the therapist to fix their problems or to tell them what to do to address their issues. That's completely understandable. However, the key concept in motivational interviewing is understanding that the change process is more effective and long-standing when the client is the one that comes to their own decision based on their personal motivations. A key concept in motivational interviewing is that it's a collaborative process where the client and clinician come together as a team. The clinician very much serves as a facilitator of the discussion, whereas the client determines which direction and how far they want to go. The clinician may raise a particular topic to explore. However, ultimately, it's left up to the client to decide whether they consider it an issue worth exploring and whether or not they want to begin to change. The therapist respects the autonomy of the client and expertise over their own lives. Collaboration ultimately is built upon establishing trust, enhancing rapport, and empowering the client to take ownership of the issue and the changes, while the therapist is there to support and encourage them. Let's talk about effectively exploring and resolving ambivalence with a client. It involves the following process. Number one, start with a gentle approach to exploring the topic. Clinicians should take a genuine curiosity about the client's feelings and thoughts about the issue. This isn't a time to confront the client or dispute them on whether the outcome is healthy or not. They may have been struggling with this for quite some time, so approach this issue with a genuine positive regard, keeping the client at the center by asking questions in a supportive and non-judgmental way, showing empathy and understanding for the struggle. Remember, examining pros and cons should also be done without leaning into one particular direction. Let the client come to a determination what the pros and cons are. The therapist is merely the facilitator to explore how the client feels about those. Finally, it's important to let the client, not the therapist, determine what they consider to be the barriers or benefits to change. Developing discrepancy is a key technique and skill used in motivational interviewing to help clients explore how their current behavior either aligns with their values, goals, and aspirations or are misaligned. This requires a very non-judgmental and supportive discussion on the part of the clinician with the client to allow for increased awareness about possible misalignments. Clients will be much more motivated to change as they see how a possible new direction might align better with their goals and values. Now, clinicians must be extra careful to show extra empathy and support, as some clients may feel a sense of guilt, shame, or sadness as they realize how much their long-standing patterns have been misaligned with their values and goals. With additional support and encouragement, clinicians can help clients to see that changes can bring them back into alignment and the benefits of doing so. Dealing with discord, or rolling with resistance, as it was formerly known, is a key concept in motivational interviewing. It refers to the therapist or counselor's ability to navigate and respond effectively to the natural discord that sometimes arises in counseling when the client isn't quite on board with the direction of either the conversation or considering the changes that are being laid out. It involves several strategies on the part of the counselor aimed at acknowledging, understanding, and working with the client's discord or resistance rather than directly opposing them. Here's how it works typically in dealing with discord. Number one, the counselor needs to avoid confrontation. Motivational practitioners strive to avoid confrontational or argumentative interactions with clients, as this tends to increase the discord and resistance. Instead, they adopt a collaborative stance, showing empathy and understanding even when faced with that natural discord that may occur. Second, acceptance and validation is key. Rather than dismissing or challenging the client's discord or resistance, motivational interviewing therapists accept it as part of the natural process of change. They validate the client's feelings and perspectives, communicating understanding and respect for their autonomy, and that this natural discord is part of deciding whether or not change is something they want to do. Number three, exploring ambivalence. Motivational interviewing recognizes that ambivalence is common among individuals that are contemplating change. Therapists need to use open-ended questions, reflections as techniques to explore the client's mixed feelings about change. This allows them to express both their desire to change as well as reasons for staying the same. Number four, sometimes the therapist needs to shift the focus just a little bit. When faced with direct resistance, defensiveness, or discord, motivational interviewing practitioners, clinicians may choose to shift the focus of the conversation temporarily. They might explore a different aspect of the client's experience or discuss the potential consequences of both changing and staying the same, helping the client consider the broader context of their behavior. This isn't to distract the client, it's merely to ask the client or to take a different angle at the topic. Number five, reflecting and affirming. This is so critical in motivational interviewing, to reflect the listening of the client. This involves paraphrasing, summarizing what the client's saying, offering clarifying statements to demonstrate that as a counselor, you're trying to understand and empathize with their position. Also, by reflecting the client's thoughts and feelings back to them, therapists show validation and encouragement for further exploration. They need to highlight autonomy as well. Motivational interviewing clinicians really admire the client's autonomy and want them to be autonomous and self-directed in the change process. Therapists avoid imposing their own agendas or directives. Instead, they need to be supportive with the client in making their own choices. Finally, eliciting change talk. Even in the presence of discord or resistance, motivational interviewing counselors actively seek out instances of change talk, statements that indicate that the client's desire, abilities, reasons, or need for change exist, even in a small segment of their talking. By amplifying and reinforcing these statements, therapists can strengthen the client's own motivation and commitment to change. Overall, dealing with discord or rolling with resistance in motivational interviewing involves more of a nuanced, empathetic approach to managing this discord, acknowledging the client's perspective, fostering a collaborative therapeutic relationship is conducive to positive change. Again, this is not the time to confront them on their agenda or try and convince them of the consequences that, as clinicians, you may feel are unhealthy or unhelpful to them. Evoking intrinsic motivation is a core concept and key skill of motivational interviewing. In fact, it lies at the heart of the motivational interviewing approach. This is when clinicians attempt to discover the client's motivations for change. This involves extra empathy, understanding, a very supportive environment in a non-judgmental way, where the clinician takes a genuine curiosity as to what brings the client into counseling, how they define change, And are they even ready to change, and what steps they're considering? Remember, the clinician does not impose external pressure, offer advice, or point out what they believe to be healthy or helpful. Let the client do that. Let them explore what they consider to be helpful. Remember, the clinician elicits the client's own ideas, values, and goals, things that are important to them. When exploring values, explore things such as who is important to the client, what is important to them, and where they want to go or what they want to develop. This could be personal characteristics or changes that they have ideal aspirations for. Remember, the counselor should explore the intrinsic motivations of the client, because this is what strengthens the commitment to change. This is the foundational element of motivational interviewing. As the clients take ownership and are more committed to their ideas and goals, they're more likely to carry these out and make long-standing changes in their lives. Supporting autonomy is another core concept of motivational interviewing, as the counselor aims to enhance the client's confidence in their ability to change and overcome obstacles. Remember, supporting autonomy is critical because clinicians are not always going to be around for the clients, particularly as they start to look at taking steps to make changes. We want clients to be the ones that understand that they are responsible and have the skills and abilities to do so. This is done by the clinician beginning to highlight and explore past successes, strengths that the clients have, talents, skills, and abilities, and ultimately resources that they might be able to use to make these changes possible in their lives. Now that we've covered some of the core concepts underlying the theory of change, let's take a step back and look at the overarching spirit of motivational interviewing, or the spirit of MI as it's called. This refers to the underlying principles and attitudes that should guide the overall practice of motivational interviewing. These principles are foundational to the approach as it shapes the therapeutic relationship between the clinician and the client. The spirit of MI is characterized by 4 key elements. Number 1, partnership. MI emphasizes a collaborative partnership between the practitioner and the client. Rather than adopting a directive or authoritative stance, the clinician works alongside the client as a partner in the change process. This collaboration fosters a sense of equality, respect, and trust, and allows the client to feel empowered and actively engaged in their own decision-making process. Number 2, acceptance. Acceptance refers to the client's right to make their own choices and decisions regarding behavioral change without judgment. MI respects the client's autonomy by avoiding coercion, judgment, or persuasion on the part of the clinician. Clinicians really should support the client's exploration of their own options. Clients should weigh the pros and cons of change and ultimately make their own decision that aligns with their values and goals. By fostering this autonomy and acceptance, MI enhances the client's sense of self-efficacy and ownership over the change process. Number 3, compassion. Compassion is at the heart of the MI approach. This is when clinicians must demonstrate empathy, acceptance, non-judgment toward the client, regardless of their behavior or readiness to change. Compassion creates a safe and supportive therapeutic environment where the client feels understood, valued, and accepted. It allows clients to explore their concerns, fears, and ambivalence about change without fear of criticism or rejection, which is likely what they've felt throughout much of their life. Number 4, evocation. So evocation involves drawing out the client's own motivations, values, and goals for change. Motivational interviewing clinicians recognize that the client is the expert of their own life and experiences. Instead of imposing advice or solutions, clinicians evoke the client's intrinsic motivators by asking open-ended questions, listening empathetically, and reflecting back the client's thoughts and feelings. This process helps to elicit and strengthen the client's internal motivation for change. Overall, the spirit of motivational interviewing embodies collaborative, evocative, autonomy, supportive, and compassionate approach to facilitating behavioral change. By embracing these principles, clinicians create a therapeutic atmosphere that honors the client's autonomy, fosters intrinsic motivation, and empowers them to make positive and sustainable changes in their lives. Let's talk now about what's called the writing reflex. This is a popular concept in motivational interviewing because this occurs to early clinicians just getting used to the motivational interviewing approach, as well as seasoned clinicians that have been in the field and are attempting to get used to doing motivational interviewing. So what is the writing reflex? Well, it's the natural inclination by helping professionals, including mental health professionals, to try and fix, correct, or even solve the client's issues for them. Clinicians may have great intentions to help, however, giving advice, suggestions, offering solutions often have unintended consequences. So what are some of these consequences? Well, it becomes problematic because they can inadvertently lead to discord, resistance, or even defensiveness in the client, as the client may feel judged, criticized, pressured to do something that the clinician offers, or even condescended to as the clinician attempts to solve the client's problems for them. So how is this counteracted? Well, this can be done through the collaborative approach that was mentioned in the previous slides. Clinicians need to elicit the client's own solutions and motivations by evoking their values, goals, and ideas for their own reasons to change and ideas for change. The writing reflex is something that needs to be paid attention to throughout the entire motivational interviewing process. We've talked about the theory of change, the spirit of MI, the writing reflex. So now let's take a step back and look at the entire process. The first step in the MI process is engagement. This involves collaboration, building trust and rapport, showing understanding, validation, and empathy. This really is the engagement phase of the MI process. This continues on throughout the entire process, but the very first step in this entire approach is focusing on these elements of engagement. We then would move on to focusing. So after we have a collaborative approach, we've built rapport and trust, we've shown validation and empathy, we begin to focus in then on identifying the issues and goals according to the client. Remember, it is the client that needs to clarify their own priorities, values, and motivations. This is done by moving to the third step, which is evoking. Using the ORS process, the open-ended questions, affirmations, reflections, and summaries, we can begin to explore the client's priorities, values, and motivations. We also then attempt to explore their ambivalence about change, and then highlight the reasons for change. What do they feel is important to them? And finally, enhancing and eliciting intrinsic motivation. This really is, once again, the core concept of motivational interviewing, is finding that intrinsic motivation according to the client. Finally, the last stage in the MI process is the planning stage. Once the ideas have been elicited, the reasons for change, the intrinsic motivation, it's now time for planning. The planning stage should be a very collaborative effort to form a plan of action. This involves beginning to set specific goals. These should be specific and measurable, attainable and realistic goals that can be done in a timely manner. The client should be helped to identify their own potential barriers and strategies. The clinician can work in a collaborative effort. Again, the perspective, though, should be from the client as to what they see are the barriers and strategies. Then, an outline of practical, realistic, achievable steps should be made to ensure the necessary support and resources are in place as part of the planning effort. The clinician should work in collaboration with the client to see what additional support they may need or additional resources that might be available to help them accomplish this. Once again, this is an overview of the entire MI process, from engagement, focusing, evoking, and then the planning stage. Let's talk about the ORs of motivational interviewing, beginning with the O, which is open-ended questions. These type of questions allow clients to elaborate on their thoughts, feelings, experiences, and motivators by going well beyond just a yes or no answer. Clients are able to explore and reflect upon the behaviors as well as the potential consequences of pursuing change. The A is for affirmations. Now, affirmations in motivational interviewing involve recognizing and validating the client's strengths, abilities, efforts and positive qualities that they bring to the collaborative relationship. These affirmations are essential because it helps build rapport, it enhances self-efficacy and autonomy, and it also reinforces the client's ability and motivation to make the changes. The R stands for reflections. Now, reflections involve actively listening to words, emotions, and nonverbals, and then mirroring back to the client the essence of what you understood as a clinician. This can involve paraphrasing, summarizing in order to demonstrate understanding and empathy. The last S is summaries. Summaries involve synthesizing and organizing a client's statement to provide a coherent overview and summary and understanding of what was said. It also helps reinforce key points, highlights patterns or themes, as well as helps facilitate reflection. It also helps to integrate some of the new insights and perspectives to enhance motivation. This is also a key opportunity for clinicians to clarify what they're hearing from the client and allow the client to then clarify whether or not the clinician is hearing it correctly. The ORs are a great skill and lie at the heart of motivational interviewing in exploring a client's ambivalence to change. Let's look at some examples of open-ended questions to explore various parts of the change process, beginning with exploring the motivation for change. Some questions might be, what are your thoughts about making a change in a specific behavior? How do you feel about your current behavior? What are some reasons you might consider changing this behavior? Number 2, eliciting client perspective. So if you want to know more about how the client sees it, here's some questions you could use. For example, can you tell me more about what led you to this point? How do you see your behavior impacting your life right now? And what do you think might be the benefits of making a change? In clarifying ambivalence, some potential questions might be, it sounds like part of you wants to change, but another part is hesitant. Can you tell me more about that? Another question might be, what are some reasons you might be feeling conflicted about changing your behavior? And finally, how do you weigh the pros and cons of making a change? This gets at trying to understand the client's own process of change. Number 4, exploring goals and values. Some of these questions might be, what are some of the things that matter most to you in life? How does your behavior fit into your long-term goals and values? And finally, what would life be like for you in the future? Number 5, highlighting strengths and resources. Some ways to explore the strengths and resources might be, for example, what are some of the strengths or abilities you have that could help you make the change? Number 2, tell me about a time when you successfully dealt with a similar situation. And finally, what support systems do you have in place that might assist you in making this change? Next, encouraging reflection. Now, some questions that you could ask about the client to encourage them to reflect might be, how do you think making a change would impact your relationship? Or what do you think might happen if you continue with your behavior? And finally, how does your behavior align with the person you want to be? Number 7, exploring previous attempts at change. This is a critical series of questions that can be asked of clients to understand what they've already tried. For example, you can ask, can you tell me about any past experiences you've had trying to change your behavior? What did you find helpful or challenging about previous attempts to change? And finally, how might you approach things differently this time around? All of these open-ended questions are a critical part of motivational interviewing as they allow the client to get well beyond just a yes or no answer, and you as a clinician can start to understand the nuances of the client's change process. Let's now look at some examples of affirmations that clinicians can use. For example, if a clinician wants to recognize the effort of a client, they can say such things as, I appreciate your willingness to explore this topic with me. Or, it takes courage to confront some of these challenges, and I admire your commitment. Or, I can see that you put a lot of thought into this, meaning the change process or considering change. If a clinician wants to highlight some of the strengths of the client, they can say such things as, you've shown great resilience in overcoming obstacles in your past, or you have a strong support network that you built around you. Or 3, your determination to improve your situation is evident. In validating a client's feelings, some examples might be, it's completely understandable to feel uncertain about making changes. Or you've expressed some valid concerns and it's important to acknowledge them. Or number 3, feeling this way shows that you're aware and engaged in the process. Now let's look at reinforcing progress. Some of the things that can be said is, you've made significant strides since we last spoke. Or I can see that you're making an effort to implement some of the strategies we've discussed. Or your commitment to self-reflection is evident and it's paying off. Now let's look at empowering statements that clinicians can say. For example, you have the ability to overcome these challenges and create positive change in your life. Remember, you are in control of your decisions and you have the power to make meaningful changes. Finally, you've demonstrated resilience before, and I believe you have what it takes to overcome this hurdle in your life or address this issue. Number 6, acknowledging client values and goals. Some things that could be said as far as affirmations is, your dedication to your family's well-being is admirable. Or you've expressed a strong desire to improve your health, and that's a significant motivator. Or your commitment to living a more fulfilling life is inspiring. Finally, number 7, reflecting on clients' insights. Some things that could be said is, it seems like you've gained some valuable insights into your situation. You've identified some key areas where you'd like to see improvement, and that's a positive step forward. Finally, your self-awareness is impressive, and it's clear that you're invested in your growth. All these are wonderful examples of affirmations that can be used throughout the motivational interviewing process as you explore these various areas. Let's look at some examples of reflections used in motivational interviewing. Now, there's many different types, so let's start with simple reflections. An example of this might be a client stating, I'm feeling really overwhelmed by everything going on in my life right now, to which a clinician can reply, it sounds like you're dealing with a lot of stress in the moment. Notice that the clinician didn't say the exact same words as the client. There were slight variations, such as replacing stress with overwhelmed. In an amplified reflection, a client might say something to the effect of, I want to lose weight, but it's so hard to stick to a diet. To which a practitioner can state, you're feeling motivated to make changes, but you're finding it difficult and challenging to maintain a diet. A double-sided reflection is frequently used in motivational interviewing to look at both sides of the client's reasoning. For example, a client might say, I know I should exercise more, but I just don't have the time. Typically, a clinician knows that a double-sided reflection is needed by the use of the client's word but. A clinician might say something to the effect, on the one hand, you recognize the importance of exercise, while at the same time, you're struggling to find time to fit it into your schedule. Number 4, emotional reflections. This is where the clinician is attempting to embody the emotion expressed by the client. For example, I feel like a failure because I keep relapsing. A clinician might be able to say something like, it sounds like you're feeling disappointed and frustrated with yourself for experiencing these setbacks. Some examples of reflections used to explore ambivalence might be the client stating, I know I need to quit smoking, but I'm not sure if I'm ready. To which a clinician can say, part of you recognizes the health benefits of quitting smoking, but another part of you feels unsure about taking that step. Now, using affirmative reflections or affirmations, a client might say something to the effect of, I've been making an effort to spend more quality time with my family. A clinician can then say something like, you're actively prioritizing your family relationships and investing in meaningful connections. Now, if you want to clarify reflections, something a client might say is, I'm not sure what I want to do with my career. To which a clinician can reply, so you're feeling uncertain about your career direction and are willing to explore different options. Summarizing reflections, A client might say something to the effect of, I've been feeling stressed about my work and it's been affecting my sleep and my mood. A clinician can summarize that by stating, it sounds like work-related stress is really taking a toll on your sleep and overall well-being. Highlighting strengths. This is where clinicians can really highlight the strengths that clients are showing within their own statements. For example, I've been trying to cut down on my drinking. A clinician can say, you're demonstrating resilience and determination by taking steps to reduce your alcohol consumption. And 10, reflecting change talk. This is so critical in motivational interviewing. An example might be a client stating, I want to start exercising regularly to improve my health. Reflecting change talk might involve a clinician stating, you're expressing a strong desire to prioritize your health and well-being by incorporating regular exercise into your routine. All of these are examples of various reflections that can be used in the motivational interviewing approach in a variety of different situations and circumstances. Let's look at some examples of summaries used in motivational interviewing. Number 1, if a clinician wants to reflect on the progress that a client has made, they may say something to the effect of, so it sounds like you've been making efforts to manage your stress by incorporating mindfulness practices into your daily routine. It seems like you've noticed some improvements in your ability to stay present and cope with challenging situations, which is really encouraging. In highlighting ambivalence, a summary might be, on the one hand, you're feeling motivated to make changes in your diet to improve your health, but on the other hand, you're struggling with cravings and finding it difficult to resist unhealthy food choices. It seems like there's a conflict between your desire to change and the challenges you're facing. Let's look at a summary that explores goals and values. A clinician might say you've shared that your long-term goal is to prioritize your family and spend some quality time with your children. You recognize the importance of being present and engaged in their lives, and you really are committed to making changes that align with these values. Acknowledging strengths and resources. A summary could be something to the effect of, you mentioned several strengths and resources that you can draw upon as you work towards your goals. Your strong network of friends, family, along with your determination and resilience are valuable assets that can help you navigate these challenges along the way. Let's look at summarizing insights that the client has made. For example, you can say, throughout our conversation, you've identified several patterns in your behavior that contribute to your procrastination. You've recognized the role of perfectionism and the fear of failure in holding you back, and you've started to explore alternative strategies to overcome these barriers. In reviewing change talk, you could say something like, you've expressed a desire to quit smoking in order to improve your health and set a positive example for your children. You've mentioned several specific motivations, such as wanting to be there for your family and live a longer, healthier life. It's clear that these reasons are important drivers for you. In identifying challenges and solutions, a clinician could say something to the effect of, you've outlined some of the challenges you're facing in finding a new job, including limited opportunities in your field and uncertainty about your future. However, you've also brainstormed some potential solutions, such as expanding your job search to different industries and seeking additional training and certifications. And finally, affirming efforts and progress. A clinician might say something like, I want to acknowledge the progress that you've made since starting to work together. You've demonstrated a commitment to self-reflection and growth, and you're taking proactive steps to address the challenges you're facing. Your willingness to explore these new challenges and try new approaches is commendable. All of these are examples of summaries throughout the motivational interviewing process. In motivational interviewing, there's an acronym called DARN CAT. So let's take a look at that. The D stands for desire. Now, desire involves reflections that focus on the client's desires, wishes, or wants. An example could be, it sounds like you really want to improve your communication skills. Essentially getting at, why does the client want to change? The A stands for ability to change. This is where the clinician is getting at the how might they be able to change. These reflections highlight the client's abilities, strengths, or resources. An example might be, you've demonstrated a lot of resilience in overcoming similar challenges in the past. The R stands for reasons. So what are the client's reasons to change, and what are some good reasons to change? These reflections explore the client's motivations, reasons, and values. An example might be, you've mentioned that spending time with your family is important to you, and you want to make changes to prioritize that. The N is need to change. So this might involve the counselor asking, how important is it and why? Sometimes this involves scaling questions. The need then reflects the client's needs and desires to change. An example might be, it sounds like you're feeling overwhelmed by your workload and you could use some support in managing your stress. Exploring the client's definition of the need is critical. The CATS portion involves C, which is commitment. These type of reflections acknowledge the client's commitments or intentions to change. This could involve essentially a question, what do you intend to change, and what do you intend to do? For example, you've expressed a strong commitment to quitting smoking, and you've already taken some positive steps towards that goal. The A stands for activation. This could involve, what are you ready and willing to do right now? These reflections encourage or reinforce the client's effort or progress. An example might be, you're actively seeking out information and resources to help you make informed decisions about your health, and that's great. The T and the S, the taking steps in the final part of CATS, involves reflections that recognize the client's actions towards taking steps towards change. This might involve what you've already done or what the next steps are. An example of this might be a statement such as, you've already started incorporating some healthy habits into your daily routine, like going for a walk or eating more fruits and vegetables. This is the darn CATS process. Desire, ability, reasons, need for change, and then the CATS portion, which is eliciting, implementing change talk. What's their commitment, the activation, and the taking steps that they're doing. Let's look at some specific skills in motivational interviewing. Let's begin to look at the ruler or scaling questions used in motivational interviewing. This is typically done on using a scale from 0 to 10. For example, how important is it for you to make this change? With 10 being the highest or the most important. Another question might be, how confident are you in being able to change? And finally, how motivated are you to change? All of these scaling questions give clinicians an important insight as to where the client stands in the change process. It also allows the clinician to focus in on which areas the client might be struggling with or which areas of strength the clinician might be able to draw from. Some questions that can be used to elicit additional details might be, for example, when a client gives a specific number, a clinician can say something to the effect of, tell me more about being at that specific number as compared to a lower number. Another question might be, what would moving from that particular number to the next highest number take for you? And finally, how can I as a clinician help you achieve that number? All of these questions, as well as others, to gather details about how the client is conceptualizing where they're at in the change process with regard to importance, confidence, and motivation, is key in the motivational interviewing process. Exploring extremes is a technique used in motivational interviewing to help the client begin to resolve their ambivalence by exploring the consequences of the status quo versus making changes. Clients can get at this extremes by having the clinician ask them such questions as, describe the positive experiences you've had with a particular behavior, or what do you like about that particular behavior? This explores one side of the extreme. For example, this could be having the clinician ask the client to describe the positive experiences they've had with drinking or substance use, or whatever the behavior might be. And what do they like about that particular behavior, such as drinking, substance use, etc. This allows the client to gain insight and explore what they view as the positive aspects of that particular behavior, rather than clinician pointing them out. On the other side of the extreme, the clinician can ask the client, describe when the particular behavior hasn't been positive, or what concerns do you have about the behavior? For example, describe when drinking hasn't been positive, or what concerns do you have about continuing to drink? Once again, let the client explore the opposite end of the extreme and the concerns they have. Clinicians can also ask examples such as, what are the best results you could imagine if you did make a change? Or what are the possible worst results that could happen if changes aren't made? All of this helps clients explore ambivalence about making changes or remaining in the status quo. Exploring extremes is commonly used and an important skill to begin to master. Looking backward and forward is another technique used in motivational interviewing and has a similar feel to exploring extremes. The clinician would have the client describe in as much detail as possible what things were like before they began doing that particular behavior or had a particular problem with that issue, or how would they like things to be different in the future. Having them describe in as much detail as possible will help resolve some of the ambivalence the client might be having. Have them picture or play out as though they were watching a video of things being different in the future. Get down to the nitty-gritty details to help the client begin to resolve that ambivalence by looking in depth at the possible resolution. Now let's look at exploring goals and values with clients. Exploring goals and values is best done using open-ended questions. For example, what are some things that you would like to achieve or change in your life? Or what do you see as the long-term goals or aspirations that you have? Exploring values and personal meaning encourages clients to delve deeper into the meaning behind those goals and values, which can be done by asking such things as, why is this goal important to you? Or how do you think achieving this goal would impact other areas of your life? Or what values are important to you when making decisions about this particular behavioral change? And finally, what does living in line with these values look like to you? Have the client explore their goals and values using open-ended questions, and getting as much as detail as possible is critical. One of the final skills in motivational interviewing is understanding the change plan and what makes up a change plan. Number one, a clinician should help the client clearly describe their goal, what it is, and get down into the details of that description. Remember, it should come from the client as far as their description of the goal, and the clinician's job is to really facilitate and help get down into those details. Number two, reminding the client of the reasons to change. This is done through open-ended questions and, again, reinforcing the client's reasons to change, not the therapist's view of the reasons. Number three, looking at the possible barriers to the goal or to the change process. Having the client identify these possible barriers, again, is critical, with the clinician facilitating the discussion. Fourth, identifying strengths. Having the clients be the one to identify what skills, abilities, and strengths they have that will help them accomplish these changes. Number five, coming up with the next steps. These steps should be small, achievable steps that the client should be able to measure and know that they're able to achieve those and that they're realistic. Number six, support persons. The client should also be helped to identify support persons that they can turn to during the change process. Number seven, describing how that the client would know if the change plan is working. Have the client explore how they might know it's working. This involves gathering details once again, having small, achievable, realistic goals that the client can then measure and see progress occurring. And the final portion is to facilitate a discussion with the client as to what would they do if it wasn't working. So having an open conversation of how this change plan might be adjusted and when to adjust it is critical to have with the client. Knowing and being realistic that plans may have to change, and when it comes to that, what would they need to do to make those adjustments? This is part of the motivational interviewing process, and understanding how change is brought about in these various steps is critical to having the client then follow through and commit to the changes that they've come up with. As with any modality, now is the time to practice. In motivational interviewing, it's critical to practice these skills so as to avoid what is called the writing reflex. The writing reflex in motivational interviewing is that tendency that clinicians and natural helpers have to go in and to want to rescue the client by offering suggestions or problem solving for the client. Although these are good intentions, motivational interviewing helps the clinician take a step and empower the client to be the one to resolve their ambivalence by coming up with their own goals and tapping into their own motivations as to why change is important to them. That truly is the essence of motivational interviewing. Thanks for listening. I encourage you to go practice.